Hi everyone, and welcome back to this channel again. My name is Noso, and in this video today I'm going to be addressing some few questions regarding NCLEX preparation examination. And the first thing I'll be talking about is how much questions should you expect for your exam. Well, there's no specific answer to this question. The minimum anyone can go in his or her examination is 75, and the maximum is 145. So when you are going in for your examination, don't have this mindset of I'm going to do 75 questions. Prepare your mind for the maximum question. Like in my own case, then, because my friend passed at 75, so I went in with this mindset that possibly I might also pass at 75, but unfortunately I had to go all the way to 85 before my computer shut down. So like my NCLEX instructor would say, that when your computer didn't shut down at 75, don't freak out. Just sit down and relax back and still continue with the examination, because as long as your computer didn't shut down at 75, that means you're still in the game. So put in all energy and don't get tired, don't get frustrated, don't freak out. So that is that for how much question you should expect for your examination. And another thing I want to talk about is what is the best resource or resources to use for your examination. Well, there are so many resources out there, but sometimes it's not good to use too many resources, and that is what I can say, because by the time you are using so many resources, sometimes they tend to contradict each other. Like one resource might say, okay, potassium level is 3.5 to 5. Another material might say 3.5 to 5.2. So it's always good to stick to one particular material. Like in my own situation, then I used NCLEX yield material. I used simple nursing for my pharmacology, which was pretty good, and I used UWord for my question assessment. So it all depends on our ability, because the first thing you should be able to identify is to know your standard, know your limits, know your level of assimilation. Some people can study on their own. Some people will say they use Kaplan. Some will say they use Saunders. These are all textbooks, which in my own case, I don't even think I can sit down and form notes on my own. So if you know your capacity that you can actually use textbook to form your notes, that's all up to you. But sometimes I do encourage people that if they have the financial capacity to go for online review, it's pretty the best. Though going for online classes or buying material doesn't guarantee that you're going to pass, because sometimes when you even study and you don't even know what they are really asking, then it doesn't guarantee your success. So I would just recommend, like, if you can go for NCLEX yield, this is pretty good. And as well as Simple Nursing by Mike. The guy is very great in pharmacology explanation, because sometimes he uses a lot of diagrams to explain, which is pretty easy for you to remember in your examination. And another thing I will be talking about is what are the test taking strategies? Well, test taking strategies depends on your content. It depends on your knowledge. Sometimes when you don't have good knowledge of the subject matter or what they're asking you, it might be difficult for you to use test taking strategies or some tips. Some people will be saying elimination method. Yes, there is elimination method, but you have to be very solid in your content. What do I mean by this? Imagine they are giving you question and you don't have, let's use example of maybe a child with sickle cell disease. Imagine when they bring in a child with sickle cell disease, we all know that in that situation, their main problem is they are having pain. And what is causing this pain is because of their circulation, which has been so difficult due to the shape of their red blood cell. So at this pain, though they are having pain, you don't want to quickly shoot them with pain medication. What they need at this stage is fluid. So it is the knowledge of your content that will really help you to know which answer you should eliminate. So when you are getting 4 answer choices, you should be able to take out 2 conveniently without wasting much time, because the more you dwell on those options, the more you get confused. So you should be able to take out 2 options, then you'll be left with 2. So from these 2, you can now use your knowledge of your content to actually pick the right option. And when you are picking answer choices, there are some words you need to look out for. Sometimes when you are seeing the word why, you don't want to pick it. Like maybe your patient, you want to do something like vital signs, and your patient is saying they don't want to do the vitals. As a nurse, you don't want to ask them why, because they have the right to reject. Then one of another test taking strategy that really helped me is that when I see any question, I always want to read the last part of the question, because this will give me the information, like it's going to tell me what to do. And by the time I know what to do, I will now read the whole question to give me more information of what I'm looking for. So these are few test taking strategies that really worked for me. But simply knowing your content very well will help you to be able to eliminate questions. And another thing when you are answering your question is look out for some important words like tell me more. But whenever you see the word tell me more, a lot of time is always the best option to take, because as a nurse, we always want to give our residents, our patients, our clients enough time to explain better. But the only situation when you don't want to allow your patient to tell you more is when you are suspecting homicide or suicide. Because if your patient is telling you that I want to go and kill myself, then you don't want to waste much time. So you don't want them to tell you more. You quickly want to act at that point in time. So these are the few things I just want to talk about regarding NCLEX preparation. Wish everybody the very best of luck in your examination. Bye for now.